Hello and welcome to this episode of That's Interesting. I'm your host, Frank Hart. This show explores things that I find interesting. I hope that you find them interesting too. There are two guests on this episode, Dr. Victoria Tumanova, who is the director of the Syracuse University Stuttering Research Lab, and my brother Don Hart of the Hart Speech Foundation is back. In this episode, Dr. Tumanova will discuss the results of the study she talked about when last here. Welcome, Don and Victoria. Nice to have you here.
Thank you for having us.
Hi, everyone who's watching. Thank you for having me as well. It's a pleasure to be here and share results of some of the lab's work.
Okay, so before we start, Don, could you give us a brief explanation of the work done by the Hart Speech Foundation, how you became associated with Dr. Tumanova?
Sure, absolutely. And thank you for having me here again today. It's always a pleasure. The Hart Speech Foundation, we founded it back in 2011 with the original charter of just helping people that are severe stutterers be able to afford to go to intensive speech therapy. Speech therapy is expensive and insurance doesn't cover it. And so it was our intent to find people that need to get that level of therapy and be able to get them funding so they could get it, with the objective being that nobody's denied the opportunity to achieve more fluent speech. Since we started doing that, and that's gone very well, we've been able to branch out a little bit into research programs and that type of thing. And that's what led me to Syracuse University, and specifically Dr. Tumanova. She's doing some phenomenal work in Syracuse, working with young children who stutter and trying to actually figure out what it is that maybe causes the stuttering, what causes some kids to stop stuttering on their own and other kids to continue stuttering. The aspect of working with young children intrigues me because what I've learned through my experience doing this is if we can get young children into the right therapy, then you can eradicate the stuttering completely. And that's why Dr. Tumanova's works I find so fascinating.
Yep, that's good. And now, Victoria, could you give us a description of the, I'm sorry, of the stuttering research lab?
Yeah, it's a pleasure to be here. It's absolutely wonderful to be able to work with the Hart Speech Foundation, and I'm really grateful for the support we've received over the years. And the work that I've been able to do, thanks to the support, is hopefully going to be helpful for people who stutter, for children who stutter, and families of these children. And what I'm going to present today is a small part of the work we do. And I'm going to share some slides. And if you have any questions, please feel free to interrupt or just tell me that you have questions. I'm happy to explain things as I go along and talk about this work. I've been at Syracuse University as a research faculty for now 13 years. And when I came in to be a faculty member at the Department of Communication Sciences and Disorders, there was no stuttering research program at the university, but the university had a long history of communication research, and we have an on-site clinic where people with different communication difficulties can get help and improve their communication. So it was wonderful for me to start at Syracuse University, and I was coming with the research background in childhood communication, childhood speech and language development, stuttering, and my work at Syracuse has been to understand speech and language development in children, in young children, and understand how stuttering, or if a child is stuttering, how speech and language development can be different because of stuttering. And the work we do is really, I think, going to be helpful for individualizing speech therapy. So speech therapy, we do have some principles of how we can help people, how we can help children communicate better, But oftentimes people wonder, how can I make it important and helpful to this individual person? So I'm going to talk today a little bit about the work we do that is focused on understanding behavioral inhibition. I'll say what it is, I'll explain what it is and how it's important for stuttering and stuttering development and what we can do in therapy for children who have this trait. I'll also talk a little bit about cognitive factors. So these are purposeful processes that help us control our behavior, regulate our emotions, linguistic complexity. So what we say and how we say it also kind of plays, a role in stuttering development. And if we have time, because I don't want it to be too long, but if we have time, I'll talk a little bit about speech motor control and speech motor learning research that we do in the lab. And all throughout, I'll try to make connections to the clinic and how these research studies can inform what we do in the clinic. So how does that sound?
Sounds like we're going to have a good show.
Hopefully. Okay, well, let's get started. So let me get my slides. Okay, there. I can move. Did it work? Okay. So it would not be complete if I didn't introduce people who work in the lab besides me. So the research team includes these people on the slide. Sam Fiorante, she's a speech-language pathologist who is helping us in many studies, including the speech therapy that we do offer for children who stutter. Jessica Sim, she's an undergrad student about to graduate and go on to be a medical student. And she's been involved in the work that I'm going to present in understanding behavioral inhibition and speech complexity for children who do and do not stutter. Jenna is a recent graduate and she is now completing her clinical fellowship for speech language pathology. And she was instrumental in seeing first and offering speech therapy for our first children for our speech therapy project, where kids are getting speech therapy, individual speech therapy for about 3 months. So, I'll talk a little bit about, the work that she's been participating in. We have now, like at the bottom row, Megan Devon, she's an undergraduate student, helps in the lab. Megan Middleton, she is an undergrad, she was an undergrad student when, she was doing the work I'm going to present. She's now a graduate student in speech language pathology. Dana Meyerson just graduated with a speech language pathology graduate degree, also has been instrumental in analyzing data, collecting data from our preschool age participants. Ava Pollock is a current undergrad student who is about to graduate and she's writing her thesis. And Madeline Holbert, she is also an undergrad student who is about to graduate, and I think she's going to actually come back to study in a grad program at Syracuse. So the work that we do is take some time, analysis are time consuming. So it's nice to have a wonderful team of people who are invested in this work and are able to move it forward. So our framework, theoretical framework, and aims in general for the lab is to understand stuttering and understand it from this multifactorial perspective, meaning that stuttering is not linked to one process or not caused by one disruption, rather it is multifactorial. So we know that it is the speech motor control breakdown at its core. So people who stutter have difficulties with maintaining the rhythm of speech. And the disruptions that they experience are with getting stuck on sounds and feeling out of control. So they talk and suddenly they feel like they're stuck, and this stuckness can come in the form of sound repetition or sound prolongation when the sound is stretched, or it could be silent tension-filled pause. But we also know through this work and the work of others that many different factors influence how often people experience these blocks, these interruptions. It could be tied to what they say, Do they speak to a friend, or do they speak to superior person at work, like a boss or something? It could be tied to if they are saying something simple, or if they are saying something complex or telling a story with many details. And it also can be linked to a speaker's level of arousal. Are they excited, or are they calm? And when there's excitement, typically there's more moments of stuttering. So this day-to-day variability of stuttering is pushing us to do our projects to understand what contributes to it. Why one day people have absolutely no breaks in their speech, and another day they can have many, and they can feel this stuckness at almost like every word they say. So I'm going to present some work looking at linguistic features of preschool-age children's speech, looking at some temperamental characteristics of preschool-age children. And these characteristics are not just relevant for preschool-age children. They remain with us. If we have a certain characteristic, temperament is typically there and not really changed throughout our lives. So I'll talk about that. But I first would like to introduce the notion that stuttering is a neurodevelopmental condition, neurodevelopmental disorder. So oftentimes when people are asked what causes stuttering, we often will say, well, we don't know. And I wanted to talk a little bit about that and kind of bring stuttering into the umbrella of other neurodevelopmental conditions that people maybe research more often or are discussed more often. So there are several disorders where abnormal neurodevelopment is inferred, but the actual cause is very complex, hard to understand with the current tools that we have. So people will say, well, we don't know the cause, or it's complex, there are so many things involved. And these different conditions, neurodevelopmental conditions, they are brought about by the brain structure and brain function. So people are born, with these conditions, and the brain may be different in some parts of the brain, the structure may be different, and the brain may activate differently for certain tasks. And many of these conditions affect communication. So how people talk, read, write, operate in the world, and these conditions are there from birth, affect children, young children, and also influence how children develop, because as we talked about last time on the show, there's a whole lot of development, especially in communication, in speech and language. It happens from birth to about 5, which is the preschool age range. So these conditions are probably familiar to everybody who is watching and listening. There's developmental dyslexia, which is difficulty reading and decoding written messages. There's autism spectrum disorders, similarly difficulties with sensory processing and navigating the world, with different sensory stimulation. Developmental language disorder, which is also used to be called specific language impairment, which is difficulty with learning the language of your community. In the absence of any other deficits or differences, such as like not being able to hear, for example, hearing loss, or autism, or anything else that would affect how people learn. There's attention deficit that can be with or without hyperactivity, another neurodevelopmental condition affecting children, but then usually continuing into adulthood. And stuttering also should be added to the list. So it's not that stuttering is just like dyslexia or just like autism. All of these are distinct and affect people differently, but most of these conditions, the common thing with them is that they affect how people communicate, right? So language development, speech development, and us, our field as speech language therapists, we are, if we're working with children, we are in general working with children who have neurodevelopmental conditions. So, and I just wanted to highlight that stuttering is also a neurodevelopmental condition, meaning that people are born with a certain profile that presents, as difficulties with the rhythm, and they live their life with with stuttering, so it never really goes away completely, but it can be more or less present as a difficulty with the rhythm in a person's life. So our work has been to understand what can affect how much people stutter and how we can help them gain control over the speech. So in general, for neurodevelopmental conditions in general, we know through research that these conditions are due to structural differences in the brain and some functional activation differences, as I was saying earlier. And we also know that kids who have neurodevelopmental conditions sometimes have more than one. And the range of difficulties could be, some people may have severe stuttering, some people may have mild stuttering. So the variability there is there, and people are not all experiencing same difficulties or same level of difficulty. So there is a lot of unique features. Stuttering, for example, tends to coexist with other neurodevelopmental conditions such as phonological delay or phonological disorder, which is difficulty acquiring the sound system of your language, not being able to say some sounds or substituting some sounds. Especially in early childhood, kids sometimes have patterns of errors. They will always substitute sounds that are in the front of the mouth with sounds that are in the back of the mouth, or vice versa. How does it affect them? Well, they're very hard to understand. If they do that, usually listeners are puzzled. What is the child saying? And these are, again, difficulties that are affecting early children in the early preschool age range. 2, 3, 4, 5-year-olds, but we hope with help and speech therapy that children would eliminate these phonological difficulties or phonological processes, and many children do. Stuttering also co-occurs with attention deficit and hyperactivity disorder in children. So somebody may stutter and have attention deficit with or without hyperactivity. So, and also important for our work is that when children have neurodevelopmental conditions, including those children who stutter, they may struggle with regulating their emotional responses. So children in the preschool age range to begin with are not good at regulating or self-regulating. You may see young children struggle with knowing if they're hungry or tired and going throughout their day and collapsing because they're too tired or too hungry and having a tantrum. So that's an example for a child who is maybe 3, not knowing what they need in the moment to self-regulate. And this is also very, very important for us as humans, because if we're not regulated, we can't really participate effectively in everyday life, in communication, we can't speak. We will be all consumed by this hunger or tiredness. And this goes on for adults as well, but adults are much better at knowing, all right, I need a break. I need to be in a quiet space without distractions, or I need a snack because I'm really hungry. And kids oftentimes can't do it for themselves. So they need us adults to help them with that. So the work in the Stuttering Research Lab, and again, I would like to thank the Hart Speech Foundation for all the help we've been getting. So the work in the Stuttering Research Lab is, the motivation for the work is to understand how speech motor control and speech motor learning may be similar or different between stuttering children and non-stuttering children. So those who do stutter and those who don't stutter. We also want to understand factors that influence motor learning and movement execution in children, because speaking is a movement. We move our mouth, we move our tongue, lips, other parts, other muscles in the mouth to produce speech. So this is a movement, which is a hidden one. We can't easily see it. Nevertheless, it's very important, and the most probably intricate, well-coordinated, fast movement that we all are engaged in. For example, another very complex movement that humans are capable of is movement of fingers, hand and finger movements such as typing, playing musical instrument, especially playing a musical instrument. Let's say if somebody plays a piano, they have to coordinate left and right hand movement, finger movement, and they're not doing the same thing usually. But very few people are piano players. But everybody talks and has to coordinate what they have to say, what the listener is paying attention to or saying to them, what their message is, what words they want to use. All of it obviously has to be coordinated with breathing, with vibration of the vocal folds to produce a voice, with movement of the tongue, lips, and jaw to make those sounds. So it's a very complex process. So people who stutter typically report, if you ask people who are able to talk about speech production, that won't be 3-year-old children usually, but kids who are older or adolescents and adults, common perception that people share is that they feel stuck and out of control. When stuttering moments happen, they feel like their words are stuck, they can't get the sounds out, and they have no control over this moment. So for us also, a goal in the lab has been to develop a therapy approach that helps people who stutter gain control over the speech, so that if they have this moment, they get stuck, how can we help them gain control and move forward in their speech? Anyway, now that I had this long introduction, I wanted to tell you what tools we use to, answer these questions. So the pictures that I'm showing are pictures from the lab. For example, this picture, I don't know if you can see my cursor moving. If you do, let me know. The picture of a girl wearing like safety glasses with lots of sensors. Are you able to see? Are you able to see me move my cursor there?
Yes, we can see the cursor moving.
Yeah. Okay. So this is a way for us to assess speech movement and speech movement coordination. So I'll be presenting some data if there's time to show how children learn speech movements and how they, how fast they learn speech movements. So that work is done with using our visual motor tracking camera that tracks movement of these small sensors. They're like small plastic buttons that we put on a child's lips and their chin, and then we ask them to wear the goggles, safety goggles, as a coordinating system, so we have a reference for where their head is moving or how they're moving their head. And this was my daughter. This is a picture of my daughter a few years ago. She's 10 now, so this was when she was 3. And that allows us to see speech motor coordination, quantify it, see what it is, and how it changes with practice. So we also do a lot of talking to kids. So the picture over here that I'm above this one, where you see a woman and a child speaking around a table. So we use a lot of free play, and we ask kids to just talk with us about the toys they're playing with, about anything they would want to talk about. And we look for different things. We look for what kind of language they use, what vocabulary, words they use, grammatical structures, syntactic complexity of their utterances, as well as what they say and not say, which, as I will be telling you in a few moments, is a way for us to assess the child's personality and temperament. So, that's how we typically assess their individual characteristics such as temperament. And we also look at some other physiological measures. For example, this boy over here wearing 2 sensors on his fingers. That is a way for us to assess the body's arousal. So we are using these sensors that wrap around the finger, and they sense the amount of sweating, this miniature sort of sweat glands we have only on the palms of our hand and our fingers, a special sweat glands. They activate when somebody's level of arousal is higher. And that is driven by the sympathetic nervous system. So somebody has to be alert, has to focus, their level of arousal has to go up for that. And typically this, it's not like somebody has like sweaty hands or anything like that, but these sensors will allow us to detect this small, tiny differences in the amount of sweat from this special sweat glands. So that's how we measure arousal. We also measure breathing, and breathing again is essential for speaking, as we inhale air and then we exhale, and we are able to vibrate our vocal folds as we exhale and communicate with our voices. And we have this, you can see several kids, this boy over here and this boy and my daughter, they all wearing a belt on their chest, which is the belt to measure breathing. It stretches as kids inhale and it relaxes or compresses as they exhale, and this is our way to assess how they breathe. And last but not least, we also measure their heart rate. And the heart rate is a measure also of arousal, alertness, and importantly also self-regulation. And this can be maybe another episode, but we are looking at specific measure that is derived from heart rate, which is called respiratory sinus arrhythmia. So that's the time it takes from one beat to the next. And when it's variable, it's a good thing. It means that the parasympathetic system is kicking in and the person is able to rest, digest, and get the body in this quiet, calm state, which is something we need if we have high arousal. We also need to be able to calm ourselves down. So parasympathetic nervous system is there for us to be able to do that. So that's how we collect our data. And again, our participants for our research projects are preschool age children who come with their family. And typically we ask kids to talk with us. We test their language using some standardized tests for screening, some language difficulties. We ask them to say some words for us multiple times as we look at learning. And the parents at the same time are watching them talk with us. And also we will usually ask parents to fill out a lot of questionnaires about speech and language development, about the child's personality, about their concerns for anything speech-related, language-related, stuttering-related. So that's how we get the data that I'm going to present to you today. Do you have any questions so far?
Any questions?
I have no questions so far. I just think it's fascinating.
Yeah, it's just amazing. I'm impressed by the techniques that you're using to gather your data. So that's...
And we always have to make it fun for our participants. So I might get to the picture where they're showing, the kids are wearing capes because we tell them they're going to be superheroes. They're going to be doing all of these wonderful things while wearing a ton of sensors, but that's like superhero gadgets. So that's our way to, get them to participate with us. So that's the trick. And surprisingly, many kids come in, never seen any superhero movies, but they all are, ready to be superheroes. So that's the good thing.
Good. That's good.
The first sort of line of work that I'm going to talk about is looking at individual personality traits, which essentially would be looking at the child's temperament. So temperament is defined as individual differences in emotional, motor, and attentional reactivity and self-regulation. So everybody's born with a temperament, and it's not really changing over time. So let's say from childhood, from infancy to childhood to adulthood, people stay with their temperament. And it can be a risk or a protective factor for developmental outcomes. And the specific temperamental trait that we are looking at, called behavioral inhibition, is more of a risk factor for developmental outcomes. And I will explain why. But in general, our temperament affects everything we do, affects language development, can affect stuttering development based on the work we do. We know that it does affect some children who stutter. And the specific trait that we again are looking at is called behavioral inhibition. It is very stable. The work of others has shown that from infancy into adulthood, it stays with a person. And it really is not something that can change over time, and it's driven by, again, structure of the brain. There is a part of the brain called the amygdala, which is in the limbic system, and that structure regulates how we process emotional stimuli. And important emotional stimulus that we process and we are, focused on is, for example, fear. So people who have high behavioral inhibition, or who have more behavioral inhibition trait in them, they tend to perceive novelty as something that is threatening at the basic level. So these people usually appear, and these children usually appear as shyer, right? So they usually, that people will call that person shy. And they typically experience high level of arousal when they are in a novel situation. It could be talking to a new person, being in a new environment, like a new room, anything else is new. And the body essentially is on high alert and takes it in and assesses it, whether it's something that they should be, considering as a threat or not. And it takes these children a little bit more time to get used to the environment. And during that time, they're hypervigilant, and they may not necessarily engage a lot in communication. So we are looking at this trait, and we are focused on how it can affect a child who stutters and is also high in behavior inhibition. And also important to mention that psychological research has established behavioral inhibition as a risk factor for later anxiety disorders. So children who are behavior inhibited as preschoolers, they are more at risk to develop anxiety disorders in adolescence and adulthood. Again, because of their tendency to perceive novelty as more threatening, and then being hypervigilant. As adults, people who are behavior inhibited probably enjoy quieter activities, less people around them. If you are at a social gathering, those who are behavior inhibited would not be approaching a lot of people, talking to everybody. They may talk to one person. As children, you can see if somebody is behavior inhibited, if a child is behavior inhibited, if you watch them in a brand new environment. So we get to do it in the lab. Kids come in with their parents, and some come in, and kids essentially take off and they run, and they are like doing their thing, exploring everything around them, and they don't know where mom or dad is, where anybody else is. They just going for it. And these kids are low in behavior inhibition, and kids who are high in behavior inhibition, these are the kids who will stay close to the parents, may not be easily separable from them, will kind of stay quiet and observant. So these are kids who are high in behavior inhibition. So one of the studies we completed recruited 68 children. Everybody was a preschooler, and we looked at kids who did stutter and who did not stutter, and looked at whether the two groups, stuttering and non-stuttering group, whether they were more or less likely to be higher in behavior inhibition. Because in general, the common thought or common maybe misconception would be that people who stutter are shy. And we wanted to see whether that is in fact the case. And in general, research shows, our research and the work of others shows that people who stutter are not necessarily more shy than people who do not stutter. And there's the full range of personalities, obviously, in the stuttering and in the non-stuttering groups and people. But as a result of stuttering, people who stutter may be volunteers to speak less and maybe participate less as a result of stuttering. But so essentially, we found out through doing this kind of work that children who stutter are not necessarily more likely to be shy, but those who had higher degree of shyness or higher behavioral inhibition, they spoke less with us. Their language was less complex. They said fewer words overall. So in this first conversation, when we are playing and talking, these kids tend to stay quieter and not say much. And also for assessment of stuttering, it was important for us to know this because we typically look at speech production, look at moments of stuttering. But if somebody doesn't talk, they're not going to stutter, and we won't be able to assess whether or not, their stuttering is mild, moderate, severe, or how we can help them. So that was important. There's one finding. I know I already went for like over half an hour, so I can, split into several segments if needed. So I just want to, tell you if you need to stop me, please do. But the next study I wanted to highlight was similarly focused on preschool age children. And this time we looked only at children who stutter. And we wanted to see how this behavior inhibition quality, this trait of behavior inhibition, was or was not associated with how much these kids stutter, how long their moments of stuttering were, how they responded to these difficulties like stuttering, related difficulties with communication. And we found that, the behavior inhibition tendency for these kids who stutter was not associated with how often they stuttered. And it's the amount of stuttering in a child's speech. We gathered this information through their parents' report. So parents had to fill out a questionnaire and say how often their child stuttered on a day-to-day basis in everyday communication. But we did see that the degree of behavior inhibition explained how much physical tension and struggle accompanied moments of stuttering for these children. So again, per parent report, those children who we assessed as having a higher degree of behavior inhibition, so kids who are shyer, they had more tension when they stuttered. So that clinically is very important for us because we obviously want kids to speak easily and not get stuck and not experience tension and struggle. And it seems that some kids, because of their temperaments, may be more at risk for more severe stuttering and more difficulties with speaking. And that's something that clinically is very relevant as we work with children. We want to consider their qualities and their unique temperament as we help them in speech therapy. Now I want to talk a little bit about linguistic complexity. So what is the style of communication, what kind of sentences children produce, what kind of grammatical markers they use. So that is all explained under the umbrella of linguistic complexity. We know that for people who stutter, for children and adults alike, stuttering tends to worsen when there are increased demands. It could be cognitive demands, such as, you're in a stressful situation speaking, such as, being on the show like I am right now, right? So that would be this high stakes situation where people would be, having more difficulty if they stutter. Or if they don't stutter, people still may have more like fillers and incomplete sentences and not really be as eloquent as they could be otherwise. When they don't have a teleprompter, which I don't. So I'm talking without a teleprompter. So the questions we had for this research study is to understand how morphological and syntactic complexity of spoken utterances affected moments of stuttering for kids who stutter. So what is morphological complexity? This would be using grammatical markers, how many the child is using. Again, we work with preschoolers. This is the time when children are not using all grammatical markers correctly, and they may be making errors, such as saying two cat instead of two cats, or I walking instead of I am walking, So again, this is the time where we are developing the knowledge of our language's grammar. So we wanted to see whether this complexity of linguistic utterances that we use, whether that affects when children stutter. And we also wanted to see whether or not children who do not stutter are more likely to have language weaknesses, like lower language scores on our tests of language for preschool age children. And we also wanted to see whether there were differences, not just in standardized test scores, but also overall language quality, again, use of grammatical morphemes, use of grammatical markers, use of syntax, maybe more complete sentences. So whether children who are preschoolers differ, those who stutter and those who don't differ in how they develop their language. So, well, this is we've about to be done with the study, and hopefully we'll submit it for publication. So we have, and I put a slide here that I have more children's data. So I will, by memory, I'll tell you I have 25 stuttering children, and I have 25 children who do not stutter who participated in this project. And everybody was in the preschool age range, and the result that we found is that children's standard language scores were no different. So those, and this is what I'm showing on this diagram here, so kids who did not stutter and kids who did stutter had about the same language scores. So the language skills were on average the same, not different. However, for some of the specific features of the language, we did see some differences. So kids who did not stutter were using language that was a little bit more complex. The sentences were a bit longer. So instead of saying maybe I like ice cream, they could say I like ice cream, but only if it's soft serve. I mean, I'm making it up, they won't say it, but so they said a bit more. So their syntactic complexity was a bit higher. So that's the difference we found between the two groups. But in terms of the use of grammatical markers, these grammatical morphemes, there was no difference. There was a trend that kids who did not stutter had a little bit more grammatical markers, but it was not a significant difference. So we would say at this point, no data to suggest that kids who stuttered had less developed grammar. Important for our clinical purposes was the finding that for children who stutter only, so in this analysis we looked just at kids who stutter, they tended to stutter on utterances or on word sentences that were longer and more complex. So what I'm showing here is what we did. This is a lot of work, and I have to thank again the students who participated in this work. So what we do is we collect data from children as we play with them and talk about, whatever they want to talk to us about. And then these conversations have to be transcribed word for word by somebody sitting down, listening and re-listening and re-watching and typing everything that the child said with all of the errors. And then we have to go through this transcript and analyze what grammatical markers they use or not use, what kind of syntactic structures they use or not use. So to analyze one child's language sample, it can take like 8 hours of work. So this is very time consuming. But this is also very informative for us for clinical purposes and also for understanding development. So using this analysis, we are able to say that for if we have the child's overall mean length of utterance, overall use of morphemes, and this is let's say at level 3.8 morphemes per utterance, they will stutter on utterances that are more complex. So as they talk and they use simple utterances, they tend to produce these without moments of stuttering. But as they say something more complex with more morphemes, with a more complex linguistic structure, that's when they stutter, and that's what's shown on this graph over here. So, and this is true both of grammatical complexity and syntactic complexity. So, important for us is to understand that if a child, for example, clinically is speaking with us and not saying much, they may not stutter at all. But if they speak to their friend and say a whole lot more, they may stutter on like many more words. So, clinically for assessment, for treatment, we need to move from very simple utterances, very low level of complexity to higher levels of complexity and help kids practice in speech therapy on, more complex words and utterances that they will produce. So I guess because of the time, I'm going to stop here and see if you have any questions for me. And, there's more work I could talk about, but I also want to be mindful of the time.
A lot of information was in that, yeah. It sounds like you still have more follow-up work to do on this. Like you've answered some questions, but those answers brought more questions. Is that true?
That's a typical process. As you embark on this, sort of investigation, what is there, you tend to find more questions as you move along, right? So as we are looking at temperamental qualities, we want to know, well, how does it affect stuttering development? We also are looking for some future projects into why children who stutter are so much more likely, more at risk to develop social anxiety. So we know through other people's work that social anxiety is children who stutter are at a 6-fold increased risk for social anxiety. So the work that I'm doing and the lab is doing with looking at the temperamental quality of behavior inhibition, sort of leads us to look more into how those children who may be high in behavior inhibition and are more at risk for social anxiety. So how can we help them and their parents sort of alleviate that risk? And the work is informed by the studies that I just mentioned, as well as the work in psychology, like cognitive psychology and developmental psychology, studying anxiety and why anxiety develops in some people and not others. So there's that kind of work. We also are, with the help from the Hart Speech Foundation, we also are not working, how do I say this nicer? We are offering a speech therapy study to kids who stutter, who are older, school age. So through this work, kids get individualized therapy, and the speech therapy, usually the process is for 3 months, we work with them. And again, the work that we do in the lab that's more like science, understanding of stuttering focused, informs on how we approach speech therapy. So yes, so I could talk about more things, but probably good to do it at another time.
Okay, yeah, that sounds good. That sounds good. Don, do you have anything? Or
Just one quick thing. I'm listening to all this, and I'm wondering, based on the research that you've done so far, have you been able to develop any new clinical techniques that would help work with those who stutter?
That's a very good question. So I can say that the new speech therapy approach that we are right now testing in the research lab, it is informed by the work we do in speech, looking at speech motor control and speech motor learning. So our current project where we offer speech therapy to children, this is again single case research. So we work with each individual participant and we analyze their data. We're not comparing groups, but we're looking how speech therapy built on certain principles is helpful, hopefully, to our participants who stutter. And that work is informed by the lab's research showing that children who do and do not stutter have equal benefit from speech motor practice. And knowing that children are better and stronger learners than older children or adolescents or adults. So this plasticity and ability to learn is greater in young kids. And we want to take advantage of it. And the speech therapy that I'm referring to is built using principles of motor learning, which come from general limb movements, like sports, athletic performance. So how do we teach somebody a movement? So we use these principles and apply them to speech therapy. So that's one example how we kind of take research finding and apply it clinically.
okay, well, that's good. Something can actually apply is coming out of it also, in addition to the information that you're gathering. That's terrific. Well, I guess we're now at the end of this episode. I want to thank my guest, Dr. Victoria Tumanova, the director of the Syracuse University Stuttering Research Lab, and Don Hart of the Hart Speech Foundation. For those of you who are watching this on YouTube, links to all of the other shows will be in the descriptions. And I want to thank you for watching this episode, and I hope that you stay interested.